screams for more oxygen. The intensive care unit in Kisumu hospital, one of the biggest in Kenya. Nurse Nicholas Otieno has seen a third of his COVID patients die. You might think the patient is improving. They might talk to you in 1 second and then they just collapse and die. The ICU is full. Otieno and his colleagues are overwhelmed. They just lost another patient. We keep hearing patients calling for more oxygen here in this intensive care unit, and there are about 15 people who are struggling for their lives. And we just had to witness how a dead body has been removed out of a room full of patients. And as you can see, the space is quickly being filled again. The hospital director is worried. They need 5 times more oxygen and far more high-flow oxygen machines than they have.
And we in Africa need those high-flow devices. They are very expensive, so we can't afford them. We lose lives that could be saved because these devices are not available.
Health officials believe the number of coronavirus cases is much higher than recorded, especially in villages where people can't afford the transport to a hospital. Jennifer Owiti buried her younger sister 2 days ago. It went very fast, she says. A bad headache, fever, shortness of breath. It all started on a Sunday when we were in church. She felt unwell. By the time Saturday came, it was too much for her to bear. She was taken to hospital, and the same day she died. Death has come to this village. Residents say there have been 50 burials here in recent weeks. The only oxygen plant in the region has reached breaking point and won't be able to meet an increasing demand.
I'm getting so many calls from patients who need to be done home care, asking for oxygen regulators. If you don't assist them as fast as possible, then in the next few minutes, that patient will be gone.
Back at Kisumu Hospital, there's some good news. A patient who's been dependent on oxygen for weeks will be released soon.
Somebody should not joke around that this thing is real. When you want to taste life, just try to remove whatever they're giving you. When you are in treatment, then you'll feel it.
Luck was on his side. In a health system so overstretched, luck is what these patients will need.